Okay, the time being 9:03 a.m. on December 22nd, 2021. I'd like to call this meeting to order of Kane County's Public Health Committee. Clerk, please call the roll.
Silva. Lewis.
Lewis here.
Shepro.
Shepro here.
Strathman.
Strathman here.
Tepe.
Tepe here.
Wallace.
Wallace here.
Sanchez.
Here.
Silva is here.
Just about to say, I see Silva online. Thank you for chiming in.
Thank you. Good morning.
Can someone ask for unanimous consent to approve the minutes of November 17th, 2021?
So moved. Silva moves.
We'll let Silva take that one. Any objections?
None.
All right, let's move on. Any questions about the Health Department's finance report for this month? All right, hearing and seeing none, is there anyone present for public comment on agenda, or we'll also take non-agenda items at this time? Are there any public comments? No, none on mine. All right, let's go to the executive director section, Kathy Foster, and then we have an update on COVID-19.
Yes, good morning, everyone. So we do have a lot of different things on our agenda, and we're going to kick it off with our update with COVID-19, and Michael Isaacson will present that today. Thank you, Michael.
Great. Good morning, everyone. Just wait a moment where the presentation comes up. So obviously, as everybody's seen in the news, we're seeing a lot more cases around the country. You may have seen the president's address yesterday about some of the new strategies that are coming out. So we'll go over some of the current highlights that we have. Main things I want to focus on are right now, everybody should be aware, especially as we continue through the holiday season here, that we're seeing more cases. We're seeing a lot of cases that aren't severe, but we're also seeing tremendous increases in the number of people who are hospitalized. And we're seeing a pretty big spike in the number of people who are dying because of COVID here in Kane County. With the new variant, the Omicron, we are expecting to see that spread quite a bit. You may have seen the CDC say that they estimate around 73% of new cases could be due to the new variant. And it seems to spread more quickly than the Delta variant. So it's still relatively new. We just identified it in the world just about a month ago. So we're still learning about it. And in terms of severity, we still have a lot more data that we need to collect. So again, we just want to continue with the same messaging that we've been pushing, but it's especially important this time of year that vaccine is the best thing that people can do. But also for everybody to make smart decisions, informed decisions as they get together over the holidays, over New Year's, to make sure that people are vaccinated. Testing is available. So if people are getting together, testing is not a bad idea to do before people get together, and then distancing. And you see the advice about having a window open, increasing air circulation, et cetera. So looking at our numbers, this is the cases that we've seen in Kane County since October of 2020. You can see the relatively sharp increase that we're experiencing right now. It's a little bit harder to see on the screen, but the green lines are our daily case counts, and then the orange line is an average. So you can see it's a very steep increase. We're not quite to where we were in the peak from last winter. But we're headed up in that direction very quickly. And again, that peak over on the left side of the screen, that was before we had vaccine available to us. So even though I think we have pretty good vaccine rates here in Kane County and here in Illinois, I think there's a lot for us to be proud of. There's still a lot of people who are not vaccinated, who are not protected. And also need to note that we are seeing cases with people who are fully vaccinated. And we're even seeing cases with people who have had booster shots. So it's typically much more mild, but we just want everybody to be aware that they need to take actions to protect themselves and those around them. So looking at hospitalizations, this is looking at the last month here in the Kane and DuPage region. And as you can see, the blue, sometimes there's blue dots and orange dots, and the orange dots mean it's stable or that there was a decrease. As you can see, for the last month, we've seen increases in the number of people hospitalized due to COVID every single day. This is reflecting the deaths that we've seen. And this data is typically about 2 weeks behind. So this was updated last Friday, and it reflects data back a week before that. And unfortunately, we lost 15 people in the most recent week that's reflected here on this slide. And the following week that is not on this slide yet, we also lost about 20 people. So as you look in the summer where we were fortunate enough to have weeks where nobody died because of COVID in Kane County, right now we are losing a lot of people. So when you hear people out in the community talking about, well, people I know who are getting it, it's not serious. Unfortunately, we're seeing many more people die right now.
Excuse me, Michael,
Yes, please, Vern.
of those that are dying, do you have any numbers of those who were unvaccinated that passed away?
We can dig into that a little bit more. It's depending on where they are. We don't have easy access to all of that information,
Okay, no problem.
but I mean, it's critically important information. And I can tell you for hospitalizations, which, you know, frequently is something that occurs before someone dies from COVID, we're seeing over 70% of people are unvaccinated. So it's a larger percentage of people who are vaccinated than it used to be. And that's just a sampling from a couple of hospitals that we've spoken to. So.
Madam Chair.
If I may, I keep an informal reading all of your reports, a tag, of how many people have died here or just have died in Kane County since it's began. And to your point, it was like 901, 902 just 3-4 weeks ago. And now it's 935.
Right.
So it's definitely ticking up, which is with great sadness.
Yeah. Yeah. And when we met with the county department heads last week, the coroner's office said they had 20 in the 5 or 6 days prior to our meeting. So unfortunately, there is still a lot of loss going on. So our best weapon against COVID continues to be vaccine. You can see in the upper right, we have almost, we're closing on 800,000 shots that have been administered to Kane County residents, which is, you know, thinking back over the last year is really amazing. We've had 111,000 residents who've had booster shots, so that's good. We want all of those people who are fully vaccinated to go and get a booster shot. So if they're eligible, the youngest can't yet, and if people aren't 6 months out from Moderna or Pfizer from their second shot, they're not eligible yet, or 2 months from Johnson & Johnson, but it is important to get the booster shot. And just to make the point, people say, well, if people are still getting COVID, are the vaccines working? Yes, they're absolutely working. They're saving a lot of lives. Vaccines, it's not meant to prevent you 100% from getting sick, but it is saving a lot of lives. So if you're not vaccinated, get vaccinated. And if you are fully vaccinated, but have not yet received your booster, if you're eligible, please do that. So you can see when boosters became available, we've seen a slight increase in demand there. And then as the younger ages have become eligible, we've seen an increase. So that's great. This is data from the CDC. We like to use this because they break it down by age a little more clearly. So you can see for the Kane County residents that are 5 years old or older, we have about 66.4% of our residents are fully vaccinated. And you can go on down through the different age groups. So 12 and over, we're at 72%. For the adults 18 and over, we're at 73.7. And then for the 65 and over population, where we saw the majority of lost lives over the last year and a half, it's good news that that's about 86%. So we'd like to see that higher, but 86% is really a good number. So just a couple of key takeaways. Again, everybody should be prepared for an increase in cases over the next few weeks. It appears that this new variant spreads very easily. And when I say prepare, I mean, when we are getting together for the holidays, as I mentioned, that's something that's really important to take into consideration. And for business owners and operators, or for us at government, it's important to plan. And you see on the news that restaurants are having to shut down because they're losing staff. We know everywhere it's hard enough to get staff anyway. So just to plan over the next few weeks, next couple months, very important to think, even with your vaccinated staff, that you may have people testing positive, and how are you going to deal with that operationally? Vaccine is the best thing that we can do. So if people go to CaneVax Hub, they can make appointments to come and get vaccine from us at the health department in Batavia at the Vax Hub. Or we have other providers listed on our website at canehealth.com. So there's about 90 providers in the community that are making appointments available to people. And then if somebody would like to request a community-based clinic, they can go to this link and the state will actually send somebody and we can set up community clinics. And this work has been going on all year. We've been working together to get clinics set up at churches, set up at schools, et cetera. So the vaccine is getting out there and it is available to people. So we're just continuing to push to make sure people get what they need. And then everybody needs to make their own decision. So we want people, especially over the next couple of weeks, to be informed about what the risk is. So when they're getting together with others, I just listed a couple of examples. So holiday gatherings, large sporting events, whatever people plan on doing in the next couple of weeks, just think about what you can do to make that as safe as possible. Being tested, making sure people are vaccinated, wearing masks, et cetera. With that, I'll open it up to any questions.
Mr. Tepe.
Tepe here. Michael, one of the questions I was asked, strange enough, last night is Kane County going to be changing its requirements in some manner like the city of Chicago is, or are we just going to stay with any state mandated requirements? So like
Sure.
the city of Chicago just put in some rules for dining and things of that nature. Are we going to do anything like that in Kane County?
Yeah, I would defer. That's a policy.
Well, that is something we would, if we have any jurisdiction over it only being unincorporated areas, each municipality would have
That's what I
to
was afraid
create
of.
their own.
That was, you're absolutely right, Mr. Sanchez. That was City of Chicago, when the mayor has jurisdiction over the city of Chicago. There are, Paramount Theatre requires proof of vaccination and/or test, 24-hour test. So it's a very recent test to get into see any of their plays. But even that did not protect the cast, and they had to shut down production for a while. So we're seeing that even though protections have been required, proof of vaccination, the test, the proof of testing, it still is rampantly spreading through. And I heard on the radio today, NPR, that it said that this is going to peak in about 6 weeks. So we've got through mid-February to really put a full court press to mitigate this. And today, in less than a half an hour, I heard that 3 members of our greater team have COVID.
In Kane County?
Yes, Ms. Bates.
Thank you.
Well, not King County, staff as well as others.
Thank you.
What?
Any other questions for Mr. Isaacson?
Yes,
Ms. Strathman.
yes, Strathman here. Michael, what is the best recommendation about home testing if you're doing a gathering,
So
as far as timing of it?
yeah, the day of is what's recommended, because of course we can all be exposed at different times. And home testing is something that there's going to be more information coming out about. So certainly the president announced that the federal government was going to make home tests available to people. We're having a couple family members over to my house on Christmas Eve, and we're requiring everybody to take a test that day that's negative. But that's not perfect. And so it's an excellent tool, but there's a couple of things from a public health department that we worry about. One, when you were exposed and when you take the test matters. So you could test negative with one of these rapid antigen tests. It doesn't necessarily mean for 100% that you do not have COVID. So we want to put that out there. Also, it gets a little more complex in terms of we shed virus at different times, so it can kind of go. So a PCR test is the best thing to do. So it's kind of a mixed bag. It's a great tool. Like I said, in my home, we're going to use it this week. But without the kind of clinical discernment and talking about when symptoms may or may not start and things like that, there's some gaps, I think, where we Currently, if somebody tests positive with one of the home tests, we encourage them to contact their provider. And if they get a positive test, they should stay home for 10 days. A lot of people are going to go out and try and get a confirmatory test, and they may get a negative test. We want them to still treat that as a positive. So that test was positive for a reason. It's much more likely that you're going to get a false negative than a false positive. So if somebody goes and gets a follow-up test that's negative and they say, oh, I must be in the clear, that's not necessarily the case. So encourage people to contact their provider, to isolate themselves immediately if they do get a positive test. And then I do expect, as we get more information from the federal government about the plan to push more home tests out, there'll be more guidance that we're able to provide. But I don't know if there's anybody else. I know we have people on our team. If there's anything else to add, no, okay.
Mr. Isaacson Gums.
Go ahead, Ms. Gums.
Thanks. I just wanted to throw in, we don't often talk about it anymore, but taking temperatures is still very important. So you might get that negative test, but if you have a fever, that's something a tool that everybody should continue to use. I just wanted to bring it up. Thank you for all the hard work you're doing.
Excellent. Yeah, that's excellent. Thank you. And again, these are layered protections. When we work with our schools, we talk about layered mitigation. Testing is one thing, it's not perfect. Vaccine is one thing, it's not perfect. Testing for symptoms, including temperatures, is very helpful, not perfect. But when you put all these things together, you're dramatically increasing the chances that you're going to keep people around you safe. So excellent point. Thanks.
Mr. Shepro?
Yes, Michael, I've had a lot of people telling me about pop-up test areas, especially in the Northwest, the Hampshire area. And first thing they asked me, are they connected with the health department? Are they licensed with the health department? They seem to have difficulty figuring out who's behind them. Apparently, they're not charging, but they're getting insurance information. And so they've asked me about that too. Do we have any idea how many of those operations are around, and to what extent can we rely on them to do what they say they're going to do?
Yeah, no, I think that's an excellent question. And this is a new need that's popped up in our community. And so people are stepping forward and filling that need. So it's a valid need. And I think there's a lot of organizations who are doing a great job with testing. I think anytime there's something new that comes to market like this, there's areas of concern as well. So the state is who actually regulates all of these organizations. So what we're encouraging is, if anybody has any issues with a lab that they think or a testing site that may be problematic, we're reporting that to the state to seek additional follow-up. We at the Kane County Health Department or at other local health departments, we don't have a way to check. If you give me an address, I can't check to see, is this a valid company, or do they have the appropriate CLIA waiver and things like that, which they would need to be able to do the laboratory testing. So we rely on the state, but there's some concern, although the majority of people we hear nothing but positive things about.
On Monday, we're coming back from Chicago, and there's a huge former auto dealership on Diversey that has converted to a gigantic, it's taken over the whole old auto dealership. And they've even got signs and so forth that seem to be doing a very brisk business.
Yes. Yeah, and I think it's a big opportunity. And I think over the next few weeks, as Madam Chair mentioned, that we expect 6 weeks for this peak. The news has been reporting that the demand, especially because this is much more nationwide at one time than it typically has been. So the demand for testing over the next few weeks is going to go through the roof. So again, most of these businesses that we're working with seem to be very valid and being operating on even whatever building they move into and however they advertise, et cetera. They're doing a good service. But if people do have questions, then we encourage them to pass those along so we can pass it along to the state to investigate.
It was suggested to me that depending on why you want the test, you might do different approaches in terms of timing and even the type of test. And I think they broke it down. They said, if you are, just want to know if you have it, you go one direction. But if you are event specific, like coming to your house for Christmas dinner, then you have to obviously, one, do it much closer to the date, if not on the date itself. And apparently use a different, maybe a different kind of test.
Yeah, and I don't know if, I mean, I'm not a clinician myself, so typically the antigen tests can be a little more quick with the results. PCR is a test that we look at more as the gold standard. Depending on where you get it done, there could be a several-day delay, and with the uptick, I've heard of some cases where it's been 6 days lately, but I think that's more of an outlier. So PCR is the best way to go, where you actually go and they send it to the lab. But again, I don't know if
That's not the do-it-yourself test.
that's not the do-it-yourself. Yeah, I don't know, Laura, is there anything else we want to say to that? I mean, the rapid tests that people are going to do, or the home tests, those are more antigen tests. And again, they serve a good purpose, but they're not as precise necessarily.
Yeah, Michael's covered that very well with everything. The Abbott rapid antigen tests that are available over the counter, roughly when you have a positive, you can be very confident that that's a positive test. If it is negative, you have to start looking at other mitigating factors, such as, were they a close contact to someone who was positive? Are they having symptoms? If that negative comes out with those, then you can be confident that it was a negative. If those issues are not there, there's no symptoms, there's no known contact, you're using this truly as a screening, and it becomes negative, you've got roughly a 50% chance that is truly as a negative or a false negative, either way.
And for the different types of tests, again, timing is really important. So for the antigen test, the days after your exposure, when it's likely to pick up a positive, it decreases a little more quickly than it does with the PCR test. So if you see a chart, if I test at day 8, a PCR is more likely to get that. So which gets to what Laura's saying.
Correct. The timing is very important with that. We typically like to test about 5 to 7 days after an exposure. It's at the peak of when that would be the most optimal time to get that positive result. After you get beyond day 7, 8, the sensitivity is not as good. So, and then you're looking 2 days prior to anyone coming down with symptoms of when they would have or received a positive test, who they would have been in contact with. So it's a varying timeline. It's always good to give us a call. We can help sort that on out. The call center has all that information, as do our staff.
And alas, that gets to why the home testing is going to add some complication, because as easy as we want it to be, it is more complicated than that, unfortunately. So,
Madam Chair.
Oh, thank you. I was speaking to Board Member Silva, and we were talking about testing and vaccination. And we know that the east side of Aurora has been pounded for a variety of different reasons. And I know that the health department has done an amazing job of outreach to the east side of Aurora to encourage individuals to get vaccinated. But it seems to be, I believe, still an issue. I don't have the data, but I believe Monica completely. So she mentioned that mobile vac site would be the most important thing, to get it on their door, basically come to their homes or right outside the street to come. And I know that IDPH, you mentioned all you have to do is call and they'll come. Now, is there a chart or some information that we can show Monica, that we can also be aware, that we can say, here's where we have been, here's where IDPH has been, this has been VNA's outreach, has it been at East Aurora High School, West Aurora High School, the elementary schools, so that there's some information, so we know if there's any gaps in services, or if that happened 5 weeks ago and we've got to get back out there again. So at least when community members or board members ask, we can say, help us, here it is.
Absolutely. Yeah, we can put that information together and show on a map where we have been. And I say we collectively, all the organizations who've been working together for this.
And when it happened, because this seems to me, because of the spread of this, and people are working, they have a variety of different jobs, organizations, churches that they attend. I think we're going to have to ramp it up if we can.
Absolutely, absolutely. And to that point, 60505 zip code, which is the east side of Aurora, continues to be our lowest uptake of vaccine. And we have worked very closely with some really great organizations. You mentioned the VNA, Family Focus, Aunt Martha's, both hospitals located in Aurora. We've really pushed to get out in the community, worked with priests, worked with soccer clubs, worked with different groups. So we've really tried. And I think what we're seeing, and this reflects what's going on nationally, is there's certain segments. So we have the Latinx population where we see lower vaccine rates. And then we see like the older white male who leans conservative, where we have lower vaccine rates. This has been for the whole year where we've had our different messaging, where we've tried to get out to those groups in Kane County to make sure that we're getting vaccines. So we're still continuing to struggle to reach everyone.
Yes, I know, but thank you so much for your help with this.
Mr. Brown?
Yeah, thank you. Michael, most everything we talk about, or not everything we talk about, but what we base our thoughts on are the numbers for the positivity rate, the data that we see. With the home kits, we're not getting a true picture any longer of what those numbers really are. If someone's testing negative, we don't know they're negative, but yet they're testing. If they're testing positive, we don't really know they're testing positive unless they're going to notify you and tell you that they're positive. So the contact tracing isn't working any longer in this instance, and we're not getting true numbers with what is really going on out there. Am I correct with this?
Fortunately, most people are still going to labs where it is being reported to us, but maybe that's going to start to change. But I think your point is absolutely correct. That's another worry that we as a public health system have about the home tests. So again, it's a great tool, but if I test positive, excuse me, if I test positive for my Christmas Eve party this weekend, and the county doesn't know about that, that means the county, to your point, does not have the ability to find out who I've been around, who I may have been exposing, because then what we would do is we would intervene and ask those people to quarantine so that they're not exposing additional people. So that is something that we need to be mindful of. And to Ms. Strathman's point, I think that's why we need a lot more information to go out to support these home-based kits as they continue to rise in popularity. And with the federal government pushing them and making them available for free to people in the coming weeks, I think that's going to be really important that we give people the information they need so that we still can get that information somehow.
Right.
But yeah, that's a big concern of ours. Absolutely.
Dr. Silva, do you have a question? And then Mr. Shepro.
Hi, good morning. Yes, to a couple of things. To Madam Chair's point regarding the knowledge of the clinics that have been taking place in our district. I think one very important request that I have is also that we're notified if there is a clinic in our district. Hopefully there has been at least one clinic in mind, but I have not been made aware from the health department that was taking place. So that is super important, because then we can get our network of supporters and very, very caring individuals to start the chain of activation to let folks in the neighborhoods know. So correct me on a couple of statements that I'm going to make. None of these are, official statements, but I want to make sure that I get this out if this information is correct. Number one, do you agree that studies show that breakthrough infection and a vaccination is our best defense against Omicron? And then the second thing that I would like to ask you to do is to talk a little bit about boosters, because I'm hearing a lot of questions in the community and in neighborhood groups regarding the timeliness of boosters and the efficacy. I did read somewhere that Moderna has very promising results regarding protection against Omicron with their booster. And the last question, I know I'm throwing them at you, so hopefully we'll be able to come back and not forget one. But the last question is regarding boosters. Is there any guidance? I know there's guidance. Could you talk about the guidance regarding which booster shot to get if one has had Moderna or Pfizer, regardless of which initial vaccine was taken? So let's start off with the breakthrough infection and vaccination. Is that a good protection against Omicron? Any knowledge on that?
Sure, I can answer that. Yes.
State your name, please, just for the record.
Sorry, it's Laura Barrett, Director of the Division of Disease Prevention of King County Health Department. Yes, vaccinations, boosters are a very good and one of our best tools right now to mitigate severe illness, hospitalizations, and keeping people healthy. So that is always going to be our request for everyone to be doing.
And I think we're still getting information, and you'll see a lot in the media about, is it better if you've had an actual infection and had a booster shot? Does it matter if you had when you had your infection compared to that? And I think especially with the Omicron, it's going to take us some time to really have good information about all of that. Definitely.
Hello, Aaron Stevens, Emergency Response Supervisor with the King County Health Department. I also just wanted to comment on that too, because there's a narrative going on in the community and at large that just because there are positive cases or people that have been vaccinated who also test positive, that the vaccine is not effective, which is false. And that was always a mismanaged expectation. So the vaccine is not designed to prevent people from testing positive or becoming infected. It's designed to prevent severe illness and hospitalization and ultimately death, which it does very well. So even Dr. Francis, who just departed from the National Institute of Health just this week, in his outgoing comments, had directed his comments towards that sentiment in the society, that there is a false narrative in social media and abroad that vaccines are pointless because people are still testing positive because of breakthrough infections. And that is by and large a terrible sentiment. It's not correct. And again, it's a mismanaged expectation that just because someone is vaccinated, they can't test positive. People can become even mildly symptomatic, but I'm sure as people have even talked to other people that they know in the society, because this is common knowledge, people that you know that have been vaccinated, for the most part, may experience some mild symptoms, but they are not the ones being hospitalized. So I just wanted to make sure that that's out there, because again, no one is saying that you cannot test positive after you've been vaccinated, but your chances are much better. And this is how we keep our ICUs from become overfull. Thank you.
Dr.
Thank you.
Silva get everything.
Mr. Chair Bates, please.
Hold on, Ms. Silva, were you finished?
Yeah, so in reference to the timeliness of boosters, when should people receive a booster after their initial vaccination? What is the guidance there?
Sure, again, Laura Barrett again. The guidance is after 6 months after you've completed your series for Pfizer and Moderna to get your booster. If you've had the Janssen's, which is also known as the Johnson & Johnson vaccine, it is 2 months later. And currently, the Pfizer is available for boosters for 16 years of age and older. The Moderna and the Janssen's is available for 18 years of age and older. As you know, back in May, we started vaccinating 12 to 15-year-olds. They have not been approved for a booster at this time. Does that help?
Yes, it does. Thank you. And then the booster, it doesn't matter what booster you get. it doesn't matter what original vaccine you received, you can receive any booster, Moderna or Pfizer?
That is correct. They do recommend to stay with the same, but if you are at a location that maybe only one of those are available, please take a booster of any vaccine that's available.
Thank you.
Mr. Shepro and then Ms. Bates.
Couple of things. First, it strikes me that the level of training and expertise between a vaccination site or operation and a testing operation are actually quite substantial. It seems as if, I mean, somebody could go to Walgreens and just buy testing stuff and then stand out on a street corner presumably and sell it or give it away. And that goes back to the point that was made about some areas I suspect are therefore going to be the problems, a differential between access to facilities is probably going to be even more different than it is now. And to Mr. Brown's point, the more people are insisting on day of or before I go into work, I would think that the less data we're going to be able to collect, just because there's, you know, if nobody's going to go drive to a test site if they can do it at home. And then that goes back to the accuracy question. So I guess, the other point I guess I wanted to make is I've talked to some folks that work at a primarily African-American college in Chicago that trains nurses, among other things. And they say that there is only about half of them are vaccinated, even though they have access to it. And that there seems to be in some minority communities, significant resistance even when the opportunity is available. And I wonder if that's true and what we can do proactive. You know, we come to these meetings and we talk about these things, but it seems like mostly we're in a position where we're reacting to it as opposed to trying to go out and solve it.
Sure. And I think two quick clarifications for the labs that people may go to that are stood up. Those should be labs that have a CLIA waiver that are working under a physician's order that are licensed to be providing that. So it shouldn't just be somebody buying a bunch of tests at Walgreens and selling them on the corner. So that is better regulated, I think, but still something that we want to monitor. Also, in terms of if somebody has to have a test to get in someplace, in most cases, that may be a test where it's not a home test. It's going to be something that you actually have to be able to show that we know that you were the person who did it, et cetera. So if you need it for work, if you need it for getting into events and things like that, typically you're not going to be able to just hold up your home test and say, yeah, this was me, look, it's negative. But you're going to actually have to have proof that it went through a more formal system. And then for the populations that are still resistant to vaccine, that continues to be an issue. And I think what we're dealing with is things that in some cases, generations of mistrust that have potentially rightfully been built up over time. And I have friends and family that are Latinx, African-American, and don't trust the system. We're trying to get people to get the vaccine and to trust the system, but we're working against many years of mistrust. So it's something we continue to work on, definitely.
I've heard that that's a problem in Africa with a lot of just basic inoculations, is that there's a resistance to getting the shots. They don't trust the people that are giving it.
Yeah, trust is critical. Absolutely.
Ms. Bates and then Mr. Martin.
So I have a question for Mr. Isaacson. Is there still an indoor masking mandate?
Yes.
So my question is, how can we get our own board members to wear masks? Especially if you're not speaking. Why aren't our board members wearing masks? I don't want to be in that room anymore.
And I think if the mandate, if people can be 6 feet apart, that helps, certainly, but otherwise that's a policy.
But it
question,
is
not
an
for me.
indoor mask mandate, isn't it?
Yes. It's been extended through the first week of January, yes.
Mr. Martin?
I have a question that began with Mr. Brown's comments relative to contact tracing. Its efficacy is being diluted by the number of home tests that we have and that type of thing. My next question is, as I understand what I read, the Omicron variant is much more contagious and has a much shorter gestation period. So my question then becomes, with us trying to parcel out scant resources, are we still producing value that have contract tracing when with a gestation period that's so short that it may not enable a true protection of anybody in many circumstances? It's like it's beyond us, and I don't want to not do it if it's appropriate, but if it's not getting us any place, it's exhausting resources and personnel and psyche to go through this exercise. And I just want to make sure that it remains a well-considered proposition.
Absolutely. And in terms of the history of public health and disease control in situations like this, contact tracing, in addition to vaccines, is our priority. So if we know somebody who has the disease and we know people who have been in contact with them, so therefore they've already been exposed, so they may already have it, us being able to intervene and ask them to what we call quarantine or keep themselves away from others, that, in addition to the vaccine, is one of the most effective things we can do. So even though we may see some dilution as the number of home tests go up, the number of tests that are coming through us and the amount of intervention that we're still able to do continues to make contact tracing a very important part of this whole intervention. But it's a good question, but it's still very important.
And I just want to add real quick that we do have people that call the health department and say, I just took a home test and I tested positive, so I need to talk to someone. So it's not just like people are not reporting it to us, like self-reporting, so.
Jared, Mr. Chair. So I guess my final thought here is, I mean, things aren't looking good, I should say. But yet in saying that, we're hearing vaccines. And the elephant in the room is, what are we going to do about the Kane Vac site? Is it going to stay open? Are we going to extend the days, the hours? What are we going to do? I know we have 90 other sites in the county that are available for this, but it's easy to sit here and say, I've heard from my constituents that they don't want to go to those. They want to go to the Kane Vac site, but I'll tell you, I've heard from one that is the case. And I know that there's more because the appointments are not available. They're booked. So what are we doing about keeping this open and extending more availability?
Well, so as everyone knows, there was a plan originally to close the site, and we had a very good conversation, productive conversation at the county board last week. And I think the general consensus on the board, I don't think anyone opposed the idea of requesting that the health department keep the Vac site open at least through January and try and work on a plan for considering a longer stay at that site. And so as of right now, and Kathy can speak a little bit more to the details, we do have some confirmation from the state that they're going to provide help, I believe, through the end of January. And we're working on extending the contract for that site. When I spoke with Madam Chair and Chris and Ms. Foster a couple of weeks ago, we agreed the host is gracious enough to give us the site rent-free in 2022 through May. And with the city of Batavia also providing utility costs. So we are working on the contract to at least have that in place so that we can have that option to continue using that site into May potentially, if we're able to. And as of right now, I know because we have to get the contract through quickly, we have to do an emergency authorization that Kathy will do. So it has been recommended by the state's attorney that we do a 1-month contract first and then come back to the board for the full authorization. And there will be some requirements for funding for cleaning services and simple things like that. So there will be some small cost, but nothing compared to the rent that we were paying before. And so things are looking pretty good on that front. Kathy, do you want to add any more detail to that? Mr. Allen is here. Oh, there, he's at the podium already. Mr. Allen, go for it.
Thank you, Mr. Sanchez. What Mr. Sanchez just briefed is 100% accurate. We're continuing to move forward to the end of January, and we're looking towards the end of May, rent-free. And Batavia is being very gracious as a continuing to help us with the utilities.
And Chairman Sanchez, if I may, I just want to point out that frequently our staff are not at these meetings. So I just want to highlight with Laura Barrett's team and Aaron Stevens' team, and we have many of them here today, Kane County Vax Hub and the other sites that we've operated are among the top vaccinators in the entire state of Illinois. So just kudos.
We're just second next to Cook. So out of all the providers.
So tremendous
Florida
work.
through Illinois.
Right. I get to go and give PowerPoints and talk, but then I have had nothing to do with the smooth operations. I'm sure every board member has heard positive comments from constituents who've been to the site, how smoothly it operates, how well it operates. So that's all due to the folks here in the room and the others who aren't here. So.
And I don't mean to interject, but I'm just, when I heard that from Kathy, I was just no surprises. But I think we need to recognize as a community, as a Kane County community, those services have not just been provided for our residents, and it's been, as Mr. Brown said, and I've got now personal comments to make about looking at other vac sites and the challenges people have had both locally as well as regionally to try to get to any of those other 90 other sites. But it has been welcoming, and we've also provided services for other counties. People from Cook County were part of that negotiations. We provided services for them. We've been providing services for Kendall coming through, DuPage, anyone who wants to come in to our vac site, they are welcome because we know that the COVID-19 virus doesn't care where you live. So I can do nothing but commend all of you for your hard work, and you all deserve trophies over your head.
Thank you, Madam Chair. And just to add to that, I can tell you we've had representatives from multiple other states, and I can attest that I have personally talked to someone from every continent in the world, with the exception of Antarctica, at our VAX clinics that we've had over this past year. So we have served not only the county, the state, the country, but the world.
So we need to get some Antarctica people up here is what you're saying.
And you've been a training facility as well.
Ms. Strathman and then Mr. Shepard.
Yes, I would like to let the county board, the health department know that I have a friend who is a nursing instructor at Northern Illinois University. There was a day where she came down last spring and brought nursing students. I contacted her. Right now they're in semester break. And so nothing can be done until the new semester starts, which is January 17th. But she is in the process of checking to see if they can come again. She also has other nursing instructor connections with other schools. And she is willing to, she can't make the decision, but she's willing to pass it on so that you might have student nurse volunteers again.
Yeah, if there's anyone on the board that has any kind of connections or anyone that might be interested in helping out in that way, contact Kathy Foster right away. We've already had a few suggestions that we've been looking at, so it's helpful.
Bates, please.
Ms. Bates.
Thank you. So I'd like to, this is a question about what qualifications does someone need to give the vaccination to administer them? What would be the minimal certification, maybe a CNA or CMA? And can we be training them, since Ms. Foster talked about how hard it is to find qualified people. I don't know who can administer the shots.
Correct. There's an executive order that extended out the availability to others not typically providing vaccinations to provide vaccinations during the pandemic specifically. So EMS, paramedics can, but they cannot do anyone under age 6. So the 5-year-olds that are currently available, they would not be able to do those vaccines. Nurses, of course, LPNs, dentists, doctors, and we've had all of those. Pharmacists also can provide those. We've had all of those here at the clinic with it. We do a very careful and thorough training for anyone that is providing vaccines at any of our clinics because we want to make sure, and we have to document that and have that ready for any state inspector that would come to any of our clinics. In addition, we are also competency that making sure that they are using the right site, right location, knowledge of their vaccines, the questions that come on up from individuals, because as we have already talked today, you have questions about when you can get that booster, when you mix and match. Those come up every time at all of these clinics, and those conversations are had with those nurses and those vaccinators that are out there. My team, the leadership team, is always there also for support to provide that and keep the flow going at the clinic. So we take those one-offs and deal with those individually and make sure that we have the time to get that information to the individual so they can make an informed decision on which vaccine they want to take.
So a CNA or CMA, can they administer?
I do not believe at this time they are allowed to.
Okay, so if we
You
want
have
to
to
go,
have, sorry.
okay, if we want to grow our own, we have to grow some more nurses, LPNs. Is the lowest level.
Yeah, sometimes medics can be utilized, and that's what we've done with the National Guard also. Is National Guard has brought in their medics too.
Okay, it's not easy. Thank you.
Mr. Shepherd, you have a quick question?
I don't know if it's quick. I certainly share in the congratulations for such a successful vac site, but I guess it leaves me even more baffled as to how we came to publicly announce that it was being shut down. And as far as I could tell, members of this committee didn't know that was going to happen. I don't think I've spoken to, I think, to just about almost every committee member, and we were all taken completely aback. And it frankly seems that it's not the first time that there has been a major public relations fiasco surrounding, actions that have been taken during this pandemic. And I'm thinking of the problem with the vaccination of pregnant mothers back in the late winter. And I guess I'd just like to understand how a decision like this came to be made in the first place, what process there was, and why was it not felt important to consult with the committee or the county board on a policy that we all thought was going in an entirely different direction. I know that there have been comments made that everybody's exhausted, which I think is true, and that more people are needed. But I checked back over the minutes and I don't see anything that indicated that we were told over the last 3 or 4 months that we were in imminent danger of needing to close a successful, well-used site because we couldn't find people to operate.
Well, I can speak a little bit to that. I think the idea that it would even close in the first place, even though it was shocking to some, we're the only county that's running a regular vax hub site at this point. The model that most public health departments have moved towards is targeted vaccination clinics. So we're talked about mobile vax unit, something that can get into those communities that have low vaccination rates. So, and due to, some of the pressures on our staff and the requirements that we have in other programs that we administer that require those staff, there was internal discussions about moving towards shutting down the site. And
were you aware of those discussions?
I was aware of it. Yes.
But it
not
wasn't
since the
important
last
to
meeting.
pass it on to the committee?
Well, there was conversations being had that I know myself, Madam Chair, Ms. Foster, and Chris Allen were a part of, discussing the concept of closing the site and bringing it to some kind of conclusion. But outside of that, it happened relatively quickly. It wasn't something that I was even aware of at the last Public Health Committee meeting. And so there could have been perhaps more communication with board members at that point. But I think what we do have is a good conversation that happened last week. And the will was expressed by the board members that they would like the site to stay open. And Ms. Foster, even without a formal resolution of the full county board, received the message and has been working very hard to keep the site open even longer.
I guess just, that doesn't solve my fundamental question of how did it happen in the first place? And board members, the chair, Madam Chair, I talked to, I did not get the impression that this was discussed in any detail other than in the most sort of speculative fashion, but perhaps Madam Chair could.
I would
Light
agree
me
with
on
that.
that.
The memory of that conversation, the parties that Mr. Sanchez mentioned were at the table. And when Kathy, Ms. Foster mentioned it, and I said, well, let's keep it open until the end of January so we can discuss. And that was where I left it. And the meeting was over. And that was my thought, that we were going to keep it open till the end of January so that we can evaluate and review. I understand that we may be one of the only regional within the collar counties. I believe Cook County, has kept their mass vac site or one of their vaccination sites open, but they also have a hospital, which we do not have. So that we can't really take a look at Cook except for our success rate of getting the vaccines. But having it shut down independently without conferring either through you or to me so that we are aware of what's going on to have that conversation. I think I said my piece last week of my concern for the public health of Kane County to have that shut down. Now, here's my examples. There was a site opened up at VNA, a drive-through regional site in Aurora. An elected official had to wait in their car for over an hour running out of gasoline. Now, I know that some of us are concerned about the environment. You've got a ton of cars waiting for over an hour to get vaccinated, running out of gasoline, and the stress and anxiety of all of that on a cold, kind of chilly day. We had talked about before, and we had public comment about the challenges for certain individuals who are not technologically savvy to give their information on the website for CVS Walgreens private provider. Now, not only we have to remember that they are private providers and they're doing a service, but they have limited staff who are doing this. They're not running a clinic with multiple people there. But also, by the time you put in your insurance information, all of your identification, sign the insurance waiver so that you won't sue them because a private provider and they've got attorneys who are protecting the corporate structure. Well, here comes the thing at the end, and I did not bring my phone with me. You have to upload a photograph of for the booster of your vaccination record. It's an attachment that you have to have. Well, if you don't have any way to attach that, you don't have a camera, you don't have a scanner, you have an old flip phone, which a lot of people still have, there's no way to do it. So even if you go, and I have a family member who was knocking on CVS and Walgreens to be able to say, please, here's my card, can I get an appointment? And they said, no, you got to do it, register online. Well, why don't you go to your local library and borrow somebody's phone to take a photograph so that you can send it to your computer so we can make an appointment for you in the next 3, 4, 5 weeks. And here we've got And this I've just heard without any prompting. People were just sharing this information with me. I did not talk about the closure of the vac site. These are the things that people have just shared. The importance of having this vac site is critical to the health and well-being of King County. I commend all of you for your hard work and your effort, and you know I mean that. And I know it's tough, but you are soldiers here. And you can't stop it in the middle of this war, this battle we have, because we're going to lose it. 935 people have died. It's been upticked by about 30 people in the last month. So we have a responsibility as a board, I believe, to be able to move this forward. And I think I have a great passion for this. And the clarity of this information, that together we work together to make sure that our information is clear, that our public doesn't get concerned, that they know that they have the county helping them out, that they can trust us. If nothing else, they can trust us on this. So anything we can do to provide help for you, all you have to do again is ask. And together we will find a way to make sure that you're provided with what you need.
In the interest of time, we do need to move on. I know Ms.
Mr.
Silva has
Mr.
one
Chair.
question. I will entertain.
Mr. Chair,
Mr. Tepe? Hold on, do you have a question? Is it
no, I have a
something?
comment. Okay. I think that Mr. Shepro and Madam Chair are being much too polite. I'm outraged at the fact that decisions were made and conversations were going on, that announcements were made, and nothing had been given to this committee for months about this particular situation. And if others aren't outraged, or maybe they're trying to be too polite, they should be. This is, to me, what is this committee for? It's certainly there to help if people need help. And it's certainly there to be consulted when things are happening. And none of that happened. And if the other members of this committee aren't outraged, I am. Thank you.
Thank you for your comments. I can ask Ms. Foster to put together a little timeline of the decision-making process that led to the idea of closing the site, if the committee would like, and we can send that out as soon as it's available. Ms. Silva, did you have a quick question before we move on?
I did actually. I would also briefly.
We can't hear you. All right, I think we lost Dr. Silva. Okay.
Wrong button, Dr. Silva. You
She was
turned off your
unmuted,
camera
it
instead
wasn't-
of
She
turning
was
on your
unmuted, but
mic.
it wasn't coming through.
There she goes.
Yeah, we still can't hear her.
Huh.
All right, maybe we can come back to that later. We do need to move on. We have a full agenda today, so thank you everyone for your patience. Next up, we have CHIP presentation. I believe staff is going to have some information for us today.
Good morning, everyone. My name is Stacy Zhang. I'm the community health planner at the health department. I'm just going to wait for my slide to go up. So today we're going to be presenting our community health improvement plan. Thank you. So our community health improvement plan is something we've been working on for over a year now. We started about last year in the fall of 2020 with our community health assessments. And earlier this year, we identified new health priorities for King County. We have been starting with our action teams, collaborating to develop implementation plans to address the issues that we identified in those community health assessments. And we have created a community health improvement plan. And I need the clicker. There we go. Okay. So this process of the community health assessments and the community health improvement plan, often referred to as CHOP, is a community-wide effort. We have worked with our 5 local hospitals and our Inc. board. So all of the logos that you see up here are our funding partners. So we work very closely with them. We also have a long list of community partners that participate in everything from the assessments to the prioritization and the planning, and bring so much to the table to our action teams and help us to inform these plans, providing us information on their services for the community. So we really would not be able to do this process effectively without our partners. So the model that we use is called MAP. MAP stands for Mobilizing for Action Through Planning and Partnerships. It uses 4 assessments, which you can see on the left here. They're to provide information for our community health improvement plan. So ideally, as we go through all of these assessments, it will ultimately lead to a healthier community. And as you can see in the picture on the right here, that's, those are the steps that we take. Okay. So we also use this process as part of our iPlan certification through the Illinois Department of Public Health. This is part of our recertification process that happens every 5 years. And it includes having available a strategic plan, which we recently did with the health department. A community health needs assessment. Again, we did that last fall. A community health improvement plan, and a letter stating that our board has approved and adopted our CHIP. Okay, so the MAP process again involves 4 different assessments. The assessments are listed here. We have a forces of change assessment, a local public health system assessment, a community health needs assessment, and a community themes and strengths assessment. They all have different methodologies and provide a comprehensive report on the health of our community using both quantitative and qualitative data. So after analyzing the results of this assessments that we did last fall, this is how those needs assessments were ranked. We had over 60 key stakeholders from around the county rank these health needs. And ultimately, we decided to take the top 5 here, and we adopted those 5 as ranking results. You can see here, these are the focused ranking results. We combined mental health and substance abuse. That was something that had fallen under the umbrella of behavioral health in the past, so we decided to keep that. We also have access to health services, immunizations and infectious disease, and nutrition, exercise, and weight. So our action teams that we created out of those community health assessments are as follows. So we have exercise, nutrition, and weight. And Uche Anwuta leads that action team. We have access to health services. Laura Barrett leads that action team. We have immunizations and infectious disease, which is led by April Elliott and Teresa Knopf, and behavioral health, which is Michael Isaacson. So these action teams have been meeting very regularly, often by Zoom, which you can see the image on the right. That's what a lot of our meetings look like right now. And Uche's not able to be here with us today. So I'm gonna go ahead and present the NEW, the Nutrition, Exercise, and Weight Plan. So our goal overall is to increase awareness and utilization of community resources for nutrition, exercise, and weight management in King County. So you can see here we have 4 main objectives. The first being by June of 2023 to create a directory of free or low-cost nutrition, exercise, and weight management programs in King County. So the way we plan to do this is we want to take an inventory of existing resources and continue to meet with our partners to determine what is out there. We'll also look at our socio needs index to make sure that the resources that are available are easily accessible throughout the county. The next objective, by December of 2024, establish at least 1 annual health promotional event. We have been working with Fox Valley Fitness Center. They have a health fair coming up. We want to host something similar to that, have it available in other areas of the county. So have more available to other areas so people know what is available to them that is low cost or free. And then by December of 2024, at least 5 community organizations will be utilizing IRIS for free or low-cost nutrition, exercise, and weight management referrals in King County. Like I'm running out of breath. Sorry.
Mr. Chairman, I'm sorry to interrupt, but I just am very frustrated, and maybe the sense of outrage that Mr. Tepe had expressed is now boiling up in me. And I don't mean to criticize the work that's being done on this, but we sit here, we have a PowerPoint read to us, and we're talking about plans for promotional events in 2024, when I think we should be talking about what Mr. Tepe brought up and what Madam Chair spoke to. I think that's the need for this committee's action. We can read the PowerPoints, and I seems to me that we're sitting here talking about planning for all these events when in the meantime, the house is burning down. And I still haven't felt that we've really addressed, comments today is don't worry, everything's going to be fine. I'd still like to know why it happened in the first place. And I really think that's what we should be talking about.
Well, I appreciate your sentiment, Mr. Shepro. As I said, we'll have a follow-up with a timeline of the decision-making process. Right now, we have a presentation on the Community Health Improvement Plan, and that's where we're at in the agenda. So anything else can be directed outside of the meeting. Thank you. Continue, Ms. Singh.
I'm sorry, you're not going to discuss items that the committee members feel are important, and you're going to.
Excuse me, Mr. Tepe.
Gloss over this?
I understand.
I understand I'm not recognized.
I understand the emotion, but we do have a full agenda. We have other things to discuss, and we did cover that topic.
I move to table this presentation.
I second.
Clerk, call the roll.
Lewis,
No.
Shepro,
Yes.
Strathman,
No.
Tepe,
Yes.
Wallace,
Yes.
Silva,
Yes.
Sanchez.
No. Okay, well, thank you to our staff for being here, but it appears the will of the committee is to table this presentation. We can bring it back next month. We still do have a resolution on this that we will vote upon momentarily. So I appreciate your presence here. Thank you very much.
Oh, thank you.
Madam Chair.
Thank you. I do have an update regarding the extension of the mass vac site, so we're all on the same page with what's going to be happening now. Okay, we can reflect that, what happened to the past, but after that conversation last week, Mr. Allen worked with Kathy Foster, and I'm sure Mr. Sanchez as well. And this is an email that I received on Monday. These are going to be the terms of the extension till January. I was hoping to get that extension on my desk before Thursday, so we can sign it. And I know it's in the state's attorney's office right now, and they are reviewing. Is that correct, Ms. Neerman?
Good morning, everyone. Michelle Neerman from the State's Attorney's Office. I just spoke with Chris Allen outside. We called the real estate agent. We're trying to work out a waiver of the fee, license fee. She believes that they will waive the fee beginning December 16th. So that's good news. We have a draft. She said that they're very backed up over there as well. So what we will do is we will, as soon as I can physically leave here and go back to my office, insert that date into a First Amendment and forward that over to her. And then I could create a blank copy or a clean copy. We could ask Ms. Foster to stop by our office and have her sign something before she leaves town today. And have that ready to go. There was a question that the real estate agent posed concerning gas and water. Since they're waiving the fee, I asked if we could address that in the Second Amendment for an extension from February to May. And she said that that might be a possibility. So we're moving in real time here. Hopefully we'll have something ready to sign very soon. I'm going and we'll have an answer for you of when that can be signed. She noted that there were no holdover provisions in the license. I'll have to go back and confirm that. But she said that we are a tenant in possession and we do have various rights, et cetera. That is true. So she did not anticipate any issues with us having it in January.
Perfect. And just so you know, just in case, I will be leaving Monday afternoon on, what is that, the 27th. So if just in case, I will be available for signature.
Very good. That sounds great. The other option is also to follow the emergency purchase procedures and have Chris Allen sign it as well. And then have everything ratified by the county board at its January meeting. At that time, we would also recommend that you entertain an extension of the IGA with the city of Batavia to cover the electric costs. I believe Madam Chair has had some conversations with the mayor indicating that they are willing to cover those electric costs. And then we would entertain a Second Amendment extending from February 1st through the end of May, which is the longest we could have the 501 site. At that point, I don't believe we have a potential at this time anyway of extending beyond May. The committee should start to consider whether it wants to look for sites, other alternative sites for June and beyond.
And that we are starting to have that conversation about. Mr. Allen and I are already starting to take a look at that. And we brought Ms. Foster into a potential site, but let's just say we're window shopping right now.
Mr. Shepro.
I would just like to note for the record that the state's attorney's office has definitely been seized with the need for speed on this. I'm looking at an email that was sent to me at 10:06 p.m. last night. So clearly the midnight oil is burning there, or at least the 10 o'clock oil. And I appreciate the effort to jump on top of this and solve the problem.
Can we now, the second half of this conversation is staffing. And I know that was of concern to Ms. Foster, but we need to address now two things. What current staffing is being promised now by IDPH? You mentioned that just earlier today that they are coming forward to be of assistance. And then the second question I would like to ask was brought up in conversation we had regarding our volunteers. So could you speak to the first one first? What is IDPH promising us?
So we just have to submit something this afternoon, putting the details forth of what we need at our mass vac site. And they gave me their verbal promise, which I believe they've come through before, that they will help us with vaccinators for January. So through January, what we need. So that is the first. So that was positive because last week we only had, through IEMA, we had resources through the 17th. So we were a little worried, and I know I sent you all updates. And then the second issue, Aaron Stevens, if you could talk to the Medical Reserve Corps and what we know about that.
Can we just touch base before you go
Sure.
forward so that this committee is in full acknowledgement of how much staff do you need? So we're talking about 2 days a week, keeping the model the same on a Wednesday and a Saturday. Is that correct for 4 hours?
Yes.
Yes.
For the hours.
Yes, correct. Continuing on with the same schedule that we've had for the past several months. So Wednesdays and Saturdays.
And your critical need for that vac site is in vaccinators or is it in other individuals?
Vaccinators. We did have some issues with the we call it non-clinical, but we were just getting anyone we could from our health department. And because when we were short MRC, and I believe that was due to the holidays. I can't speak for sure. I know Aaron might know more details, but
The critical need with staffing was namely vaccinators, which is mentioned in the report, and then also clinical oversight always is going to be a challenge with Laura's program director of disease prevention, namely because that's the position that oversees all nursing, all clinical operations, drawing, making sure doses are correct, answering questions clinically based. And unfortunately, that's just kind of a bottleneck type of situation where you only have so many people that are at that skill level and also willing to work for a public health department that will continue to be able to provide that service. So that's always a challenge. I'm not going to go into further detail because Laura can definitely defend herself on that one. But for our purposes, for mass vaccination clinic, for this conversation, it's vaccinators. IEMA's promised to cover us through the end of the month, which is fantastic. I do believe that that's when volume will drop off significantly as the end of January, looking at previous numbers. So that's that. And I just wanted to do a quick plug for the Medical Reserve Corps, who are fabulous people throughout the entire community who have supported us for over a year now. Thousands of hours, and I just wouldn't want them to go unrecognized on public record. They have already been taking care of us for a long time and have continued to do that, but we've sort of abused them at this point.
So thank you for that, Aaron. So according to your chart here, so we again have a clarity of what staffing needs you are. It's approximately 27 people as we go down the grid. If we vaccinate 800 to 900 people per day, it'll come to about 27 vaccinators you will need during that 4-hour time frame. Give or take, is that correct?
That is correct. It does ebb and flow. And we, of course, depending on registration, we don't want to go too far into the details. And we are doing okay with that as long as we have the vaccinators from the state. So at previous discussions, we didn't know if that would be continued to be provided, but now we do. So that's the name difference.
The only thing I would add to that, again, this is Laura Barrett from the Health Department, is the skill level that we have of those vaccinators. So depending on what their abilities are and how many that they can go through, you've heard here today, you've heard here previously, we've got satisfaction surveys of the great job that we're doing. We don't want that standard of care to drop.
Absolutely.
We don't want delays going through the throughput. And so it's really important to have the right mix of staff available at the site, whether they're vaccinators or non-medical staff, and also the volume to be able to handle those that are coming in. We are a very unique site that we offer all vaccines at all times, and we have been doing this since May. And that takes a certain skill mix, and there's certain safety measures we have to put into place so that we do not have unsafe practices going on that we want to make sure we're vaccinating everybody safely and confidently.
Of course. So that'll bring to the next question. We'll have, and I have one more question after that, if I may. How are we going to organize volunteers? Mr. Wallace mentioned that his wife is a practicing nurse at Del Nor, and that she may have a collective group who may be able to volunteer on a Saturday, or as they're able to, because I know they're being smacked hard right now, but other volunteer groups as well. How do we move forward with that so we can get the word out so that they know exactly on a given Wednesday in January, we could use 10 vaccinators?
Absolutely, and thank you for asking. So the best way to do that is to go to canehealth.com to the page for Medical Reserve Corps. So even simpler is just to Google Medical Reserve Corps Kane County, and there is a large banner at the very top that says MRC. You click on that, and we have a very simple online application process. If that is difficult or too time consuming, you can also contact the Kane County Health Department at 630-208-3801. Please, I can not remember numbers when I'm speaking publicly, so thank you. But that's also another way. You can just contact us at our main number at the health departments, and we will take care of you over the phone. No questions asked, as long as, of course, you have the required qualifications. Thank you.
And those required qualifications, do you have to go through a vetting period, doing background check, et cetera, before you're allowed on the floor?
Depends on where you're coming from. If you have a current licensure, especially if we're talking medical volunteers, and we can automatically check that through a state system to see if you have a current licensure. And if you are actively employed with a recent background check history, we can expedite the process and verify your background check has already been completed through a separate employer or another organization. If you've been out of the workforce for several years, we can evaluate that on a case-by-case basis. But it's still it's a very quick process. We do that with our Regional Office of Education. They have been working with us over the past several year or so, especially with COVID, and expediting that process for us very quickly, and it's been working out very well.
Before I get on to my next question, and thank you for the time for this, can we have Julie Mann now, who's managing our Office of Public Information. Can we please get something with the health department, which we can put out the word and make sure that there's a succinct and appropriate follow through. So let our community of healthcare providers, whether they're retired or currently working, know that there's a call for help. And if we get help, we make sure that you'll be completely organized to accept that help, so that it's very structured, that they'll know on any given Wednesday, please come to our VAC site at 12:30. You'll go through a pre-training program, lay of the land kind of thing, and off they go.
Okay, so we'll do a feature article for MRC and recruitment through Julie. correct?
Perfect. Excellent. I'm sorry.
Mr. Chair.
Mr. Wallace.
If I could just interject with a question. Is there, I understand relying on some of the other governmental organizations for volunteers and for help, but is there a volunteer coordinator, someone within the health department that's actively reaching out to not only the other agencies, but also to even private medical groups, schools, to see that? My understanding is that nursing students are qualified, CNAs, paramedics. Has anyone reached out to fire departments to see if there are personnel there that would be willing to volunteer?
Yes, absolutely. And so this, of course, has been going on for some time. So before we started with our mass vaccination clinics back in January of 2021, excuse me, we had reached out through several associations that work both through the hospitals and all EMS agencies with the fire departments. So City of Aurora, City of Batavia, City of Geneva, City of St. Charles, many municipalities were on board with us for several months, providing thousands of vaccinations. Worked out very well. Them alongside with the Medical Reserve Corps. So we did that for several months. Once we went to Batavia and the state essentially came to provide resources through contractors, we no longer needed as much assistance from the community. So it became more of a state assistance site that went all the way up and through the summer. And then we were carrying very low numbers for that period of time. And actually, that kind of fed into the decisions on how long to extend this site because we were at a trickle for quite a while. And so, of course, boosters were approved. So when boosters were approved, we felt confident that we could staff this between Medical Reserve Corps, a few partners with Amita Health, and our health department staff. And so we were doing just fine up until about beginning of December. I requested from the state that they send us help, which they are able to do. So that was the first request, is just to go directly to the state because they have people on contract ready to go for that reason. So before tapping overused resources within our own community, I just figured that made sense. So they were able to provide that. And so the most recent transition or question of how long that would extend was just a kind of a formality of trying to make sure that the state had approval. So to answer your question, we haven't reached back out to these community organizations as of the last couple of weeks because we felt pretty confident that we were able to get that from the state. If we needed to, we do have individuals that do that. Myself, my team, Katie and Connor here, both work with all of our community organizations and have been for quite a while now.
If I can just ask a follow-up question. The actual times on Wednesdays and Saturdays, I understand you have 4-hour time. How quickly are those filling up? Are they filling up at the current time? Are all of those time slots filling up and are people having to go to a further, to a subsequent clinic session?
So for January 5th and 8th, which are our next two future clinics, they are not, none of the slots are full except for, I believe, one on the 8th. So almost every single slot throughout the 5th and 8th are more than 50% open right now. We just checked while we were sitting in the meeting. But going to, I think, Mr. Brown's comment earlier, they were filling up before Christmas and they were filling up usually within 24 hours of the appointment. So at this point in time, people are waiting until the last minute to register or walking in. So it's a hard thing to anticipate too far out. But as of right now, our appointments for the 5th and 8th are not full.
I'm just wondering from an efficiency standpoint.
Wait a minute, isn't that just for children? Aren't you just doing, did you open it up? Because that's
We
what
we did open up for adult doses
It
as
is
well for the
On
5th
the
and 8th.
5th. So it's, yeah, because originally it was going to be just pediatrician or pediatric. And we opened it up just because we were there. So we opened it up and then the 8th is everyone.
And has that been publicized? Because it was publicized for the pediatric. Has that been publicized for the general population?
Well, we sent out a press release saying we were going to be open up through January and to go to the schedule. And at the time when we sent that out right away, we didn't know exactly what our schedule was going to look like. We were still working on it, but we wanted people to know we were going to be open through January. And so when people go on, they can click on the dates and they'll see the availability.
Okay.
Aaron, what are we up? We're on the 5th and the 8th are loaded?
Correct. And I do want to just say right now on record that because we just got confirmation literally in the last 24 hours, I believe it was at the end of the day yesterday, that the state will be able to continue to provide vaccinators. We will be posting appointments for the rest of January this afternoon.
Okay, good.
And just one more follow-up. The reason I ask about the, whether they're filling up from a standpoint of efficiency, if the difficulty is to find 27 volunteers for a time period, I would think that it would make more sense to simply extend that time period if you already have the volunteers present rather than having a 4-hour clinic, to have a 6-hour clinic or an 8-hour clinic. If we're having difficulty servicing all the people that are, that are either with not being able to make appointments or people who are showing up. I don't know how many people just show up. I know that that's
Sure.
been an issue in other counties.
And that is, I would say, a good observation, but we've taken into account highest peak times, what's most attractive to the public, when our highest demand is, how we get as many volunteers over a certain period of time, and all those little, wins that help us be successful over the past year. And so we're sticking with 4-hour clinics, one, because of demand. The appointments that we did have in December, Moderna boosters were filling up really fast. We had Pfizer appointments open and available. So we were not completely sold out, even in December, even in those clinic times. And also, we know that our highest peak is usually in the morning, and then also right around lunchtime. And then the entire chunk of the afternoon from about 2 to say 4 o'clock really falls off pretty significantly.
Mhm.
So we know that even if we have staff there or volunteers, we're seeing a trickle during those hours.
Understood.
Before we move on, Dr. Silva, did you have a question?
Hi, thank you. Can you hear me?
Yes, we can hear you now.
Okay, wonderful. Thank you for that. So I just want to say a couple of words regard to staff. Thank you for the work that you do. We understand that the community health assessment plan is the backbone of public health, but this conversation was very necessary in order for us to make the decisions that are imperative to the health of the county. So I look forward to hearing more about that as soon as possible. One request that I have, if we can have an email sent out regarding the qualifications for possible vaccinating volunteer vaccinators, that would be wonderful, so we can get that out to our constituency. And I did want to make you aware of a situation in 60505 on August 8th. Constituents are telling me that a clinic was set up and people at a local church were very excited about it. But it turned out that they think BNA was organizing it, and that they were at the wrong clinic. So they wrapped up and left. And we had a lot of people that were left wanting their vaccinations. So these sorts of things are happening out in the community in 60505, and I can try to get more information, but I did want to make you aware of that. And then also, could somebody give me a call? I'd like to have a meeting with you regarding a possible clinic in the 60505, possibly District 7. Thank you.
Very good, very good.
Thank you, Dr. Silva.
Can I just have,
Madam Chair.
and then I promise. There was a meeting of all of our department heads that I held this week, and it was a robust, wonderful conversation. And one of the things that Kathy brought up is OSHA, the OSHA requirements that may be changing here in Illinois now that the federal, and Kathy, can you explain what you talked about OSHA? Because it came as quite a surprise on this news about companies who have 100 employees plus have to be potentially have to be vaccinated here in Illinois, and its potential impact upon government, which would be Kane County, to make sure that all of our individuals who are not been vaccinated may have to be vaccinated. And then a spill-off impact, what does that do for all of our municipalities? What does that do for our school districts, et cetera? Because that's going to impact our vaccination site.
Okay, so that was brought up. There was discussion with Jamie and HR who brought up about OSHA. My thing is there's going to be people that are going to want to have vaccinations, group vaccinations like clinics, but I believe that will be covered through IDPH. So, and we're going to have to see what happens, but, and did you mean for Kane County in general? Because
Yes.
That's going to have to be a decision, I believe by the board, right? Whether or not, because that will be policy, whether or not we will be mandated to be vaccinated or we can be tested. Because right now, because there are, what I brought up is in other health departments, if you don't get vaccinated, then you are no longer going to be employed with lawyer.
So that, I'm bringing this up because the vac site, so I'm just talking about institutional vac site, that there may be a need, depending on what Illinois OSHA requires, that vac site is going to be a critical support facility to enable people to get vaccinated, as it had been before with our educators. I'm just following the same pattern that had been before. So that may have to be extended out completely then through February and March to get not just the current population who's getting boosted or vaccinated, but also people who are employees. Now, whether or not, depending on how strict Illinois OSHA comes through, I do not know whether or not it's going to be mandated as the city of Chicago is requiring. And there's been, I'm sure you've read all sorts of pushback back and forth with that. If that is something that potentially would be required by us, by the state, that is something that we're going to definitely need to have constant updates. And Ms. Neerman, if you can kind of steward that for us, so we're not, I just don't want us to be caught short without having good, effective policy decisions made by the board.
An update on that at the federal government level, the courts have lifted the stay. The rule is proceeding for private employers in Illinois. Government employers are covered by Illinois OSHA. When you have an approved state program, you have to implement or be as rigorous as the federal government standards. So we will be seeing from Illinois OSHA, the Illinois Department of Labor, standards that will come out. I have not checked today to see if those have come out. Those should be coming out very soon, however. I actually do have a meeting with Jamie Labrillo next week to discuss potential policy suggestions. The Federal Department of Labor has come out with template policies for employers regarding mandatory vaccination and/or testing.
Mm-hmm. Thank you. And the testing, would that be something that an employer would have to pay for? Would that be something that Kane County would be giving out, or would that be something that Illinois would be giving out? So what is the cost?
We'll have to see what the Illinois Department of Labor says about testing. There is guidance out there that says that if it is a mandatory requirement of the workplace, that it must be paid for. There is some thought that if you have a choice between being vaccinated or being tested and you choose to only to be tested, then that might be your cost, the employee's cost.
We are going to be having a special board meeting. I think it's scheduled, forgive me, if it's either the 6th or the 7th. When we come back, we have another issue we have to talk about. So would you be ready to talk about this? You think you could update us at that time?
I apologize. I personally cannot do it. I will be in the Grand Canyon on that day.
That sounds lovely.
Hopefully hiking, and but we can, kind of talk about some other updates. I would definitely back in town on the January 11th.
Okay.
So I could personally do it on the January 11th.
Okay, very good. That'd be very helpful. And I know the board would appreciate it.
Great.
Thank you.
I have a volunteer question.
Mr. Shipro.
Excuse me. I believe in Ms. Foster's first email, there was a long list of personnel that were needed, many of whom it seemed to me were not medical personnel. And that strikes me that might be a different category of volunteer. We just need people to point people toward the door, or here's where the line is. Perhaps there are other sources that would be able to reach out and get those people. I don't even know if they're volunteers, obviously, they're not being paid.
I can speak to that, sir. Yes, we have been staffing the non-medical positions, namely with the Medical Reserve Corps, and then also the Office of Emergency Management and the Sheriff's Office have been an incredible, tremendous support throughout, going back to the fairgrounds, and they continue to support us, and they have committed their support through January. So at this point, we feel confident that we can cover the non-medical positions. However, we're always encouraging individuals who are interested to come and volunteer to contact us. Because of the volume of volunteers we've had in the past, I'm not saying that it's the current volume right now, but because of the volume of volunteers that reached out at the beginning of COVID, it definitely is a much more efficient process if they come through the Medical Reserve Corps. So we would encourage anyone who is interested in volunteering at the Kane Vac Sub to again contact us through the Kane Health Medical Reserve Corps application. And as Dr. Silva requested, we will also share that information and phone numbers and contact information with you all.
But right now, you feel that you have adequate resources in that category of volunteers.
We do.
Thank you.
Madam Chair, did you have another? Okay. Anyone else that has any questions or comments on this issue, this topic? Okay, thank you for the robust conversation. We'll move on. Pat Fair was going to deliver her analysis on the health department, her final report. I asked her if she could come back next month to deliver that. So we had a little more time to focus and have time for questions on that, and she agreed. So she will be back with us next month. So we're going to defer that part of the agenda until January 19th. Mr. Shepard.
I asked just a quick question about it.
Sure.
Is the PowerPoint that was sent to us, is that the report or is there more to it?
I believe that is the report, and she had a PowerPoint as a presentation that she was going to deliver.
But I think that's what you sent us, where the power.
Yes, the final report.
Okay.
Yeah. Okay, so let's move on to resolution. We have authorizing adoption of 2021 to 2024 Community Health Improvement Plan by Kane County Board. I'd ask for a motion and a second to discuss and potentially approve
I'd like
this.
to move to postpone that to the next meeting after we've seen the presentation.
Okay, is this a timely matter that we need
Well,
to?
this is something that we approve. We have to send into IDPH for approval for our board certification.
If we wait until the February county board, would that be?
We have to submit by the end of January.
So ideally, we'd like to submit that at the end of January.
Yeah, we did, because of the pandemic, we did apply for an extension too already.
So it's due the 1st of March.
Mhm.
So we want to allow time for them to receive it and read it.
Well, barring the presentation, which we can have next month at Public Health Committee, I would still ask for a motion and a second to pass this so that we can get this turned in, approved by the county board and turned in on time.
Point of information, do we have a motion on the table?
Not at this time.
Okay, I'd like to move this item.
Okay, Silva moves. Dr. Silva. And do I have a second? Anyone that would like to second this motion, this resolution, that we can pass it on to the county board to get approval in time? Anyone?
I don't know if this is appropriate, but I'd like to move this forward so it doesn't, so this item doesn't place an undue burden on our already highly taxed staff.
I would agree. So is there no one that would like to give a second to this resolution on the committee?
Chairman,
Mr. Rathman?
I need some clarification. What is it that we're moving?
This is the first resolution adopting the Kane County Health Improvement Plan.
Oh, okay.
This is part of what we're required by the Illinois Department of Public Health to submit a plan. And there's several things that we have to do in order, and this is one of them that we have to submit to the IDPH to be a certified public health department.
I will
Okay.
second.
Strathman seconds. Any discussion?
Yeah,
Mr. Shepro?
Lewis,
So really, our participation review is perfunctory. That's my comment.
Ms. Lewis?
yeah, I just have a quick question. As we did start to review that, I had a question about the timelines on those because it looked like that last slide we were on about the health and fitness, we don't plan on doing anything till 2023. And I was kind of, that's why I was not voting to move it forward because I wasn't sure about those timelines.
Stacy?
Just my comment.
Approach the podium. Thank you.
Hi, Stacy Zhang. So as we planned out our activities, it is a 3-year timeline. So there are activities throughout, but the first year is a lot of planning for the activities. And then, each action team has a different set of objectives and timelines. So they do vary throughout the 3 years.
Does that answer your question, Ms. Lewis?
Yes.
Okay, thank you.
And then I just want to remind that we are aligned with the 5 hospitals and the Inc. board on this together with we form Kane Health Counts. So
A lot of work's gone into it. Mr.
Question.
Shepro?
Is this the first time that we have been presented with this plan
Yes.
that has to be adopted at this meeting? I think when we've adopted the land use plan, it isn't sprung on us with, we have to act on it today because everybody's relying on it. It seems to me that if our review and input is really sought, we needed to see this before the meeting at which we have to adopt it or everybody gets in trouble. It's just very frustrating.
Any other questions or comments on this resolution? All right, hearing and seeing none. Madam Chair?
Just clarification. I believe you said that we don't need to submit this until March. Is that correct? And you have an extension right now?
That is when the extension moved the due date to March, March 4th, I believe
So
it is.
there is not a lot of breathing time, but there is time for the board or definitely this committee to be able to take a look at it and have questions and have those questions answered in time for the February meeting without interfering in any of your goals and objectives that you need and requirements that you need to do.
Sure. We had hoped to make any adjustments based on comments from Public Health Committee and have that approved by the board in January to be able to submit and have a few weeks before the due date of March 4th. I think that if we're still able to send it off early February, we would still make that deadline.
And this committee can have a special meeting if it so chooses just to discuss that issue,
We can, yes.
you could.
which may help.
I can definitely send out the plans. They could
Yeah.
be.
But that's depending on what the committee
And I
decides.
do want to make sure that I report too, that we did present to the Health Advisory Committee. That was just within the month. So we did seek feedback from the Health Advisory Committee.
Oh, I'm sure you've gone through the proper protocol, but the point
Okay.
is that this committee has not had a chance to review and reflect and to ask questions and to suggest changes. And I think what they're sharing with you is that they don't want to just give you a rubber stamp, that they want to be participatory in that decision-making process.
Is that something this
Mr.
committee would like to do, is to have a special meeting to discuss this item? Is there any objection to that, actually? Let me phrase it that way. Is there any objection to holding a special meeting? A time and date to be determined? It would have to be, I would assume, the first week in January at some point.
Mr. Chairperson,
Dr. Silva?
I have no objection, and as a matter of fact, I appreciate and understand the frustration of my colleagues who want to remain participatory and care about what's going into this plan. So, if we do have time to look at this and vote on it and discuss it amongst ourselves, I would go in that direction. I just wanted to make sure that we didn't table an item that was time sensitive.
Well, I think if we have a special meeting, then that I think solves the problem, because we did table the presentation today. And we are running late on time. So is that agreeable then? There's no objection to a special meeting? And I'll follow up with everyone to determine the best time and date that would work for everyone.
I move to table this motion until our next meeting in January,
To the next special meeting of this committee.
whichever meeting it is.
Yeah, the special meeting.
second.
So that we can do it before county board.
Point of order, you did have a motion on the table, so I think the motion needs to be withdrawn before you can make
because
a
I would-
motion to table.
No, there's a motion to table
is a
to a
privileged
later
motion.
date.
That
Yeah.
would take precedence over the pending motion,
All right, thank you.
voting, putting it up or
Yeah,
down.
so we have a motion to postpone this vote and discussion until the next, the special meeting of the Public Health Committee. Mr. Tepe.
I second the motion.
Motion, Ms. Dr. Silva seconded. Clerk, please call the roll.
Lewis,
Lewis, yes.
Shepro,
Yes.
Strathman. Yes. Tepe,
Yes.
Wallace,
Yes.
Silva,
Yes.
Sanchez.
Yes. Okay. Next resolution, I'd ask for a motion in a second to discuss and potentially approve authorizing FY22 budget adjustment for COVID-19 crisis grant. Anyone like to move and second this
I'll
resolution?
move it to put it out for discussion.
Shepro moves, Wallace seconds. This is accepting some more money from the state to help us in our COVID-19 efforts. Kathy, would you like to give us a little more background on this one?
Yes, so this is to enhance our training and our preparedness and recovery initiatives. So there are some employees that are in this that are in the budget, and we also will be using an outside agency for some of the training. I'm very excited because we're actually going to have a workforce development specialist starting in January. We've had that in the budget since 2019, and we're finally going to be hiring for that person. So yes, so I'm very excited about enhancing, having some funding to enhance the health department with this money. And then I believe Cannell is on if there's anything he needs to add.
Are there any questions on this resolution? Madam Chair.
Is this thank you. Is this an annual grant or is it a 2 or 3 year grant?
No, Cannell, are you on? Because
I believe it goes until
This
2023.
it's just,
It says in the resolution.
I don't know the exact.
Right above that table, there's a paragraph that discusses
22, it says 22 budget.
the third whereas it mentions, which will continue. Additional funding is to be used to develop public health workforce
Mhm.
support,
23
which will
June
continue
30th.
until June 30th, 2023.
And so your expectation of getting this money, once we approve it, or the committee approves it, you'll receive it probably in the springtime? When are the allocation? So it's about an annual grant then.
Well,
hi-
we don't
hi-
know that.
Hi, this is Cannell Snowden.
Go ahead, Cannell.
This grant is for 18 months. And as of now, our expectation is that we will, there's no plans, from my understanding, to receive this grant again. This is the first time, and it's basically COVID related to assist health departments in development of their workforce, as well as training existing staff, interns, to help provide support to the health department during the pandemic.
Okay. So it's a strike force, development of a strike force. It's basically what
Yes.
this is, which is fine.
And Canal's right. So the intern is strongly a part. We're working on partnerships for internship programs and to actually have paid interns, which we've never had.
Excellent.
We've always had to unpaid. So this will afford us that. Hopefully, we're going to get some good paid interns. So
Mr. Tepe.
Is this all going into the 22 budget, or is it also going into the 23 budget? If it was for 18 months?
It'll go both. It'll
No.
go both.
Canal,
Well, it would carry over, but we can't put it in the 23 budget yet because it's too early.
Because that's planned for carryover.
I don't know if it.
Yeah, hi, this is Canal. It is basically 6 months into the, so from January, for its grant year, the grant year is going to go through June of 2022. And then the second part is going to be 12 months in going from July through 2023. So yes, there will be a piece that will be in 2023's budget, but since we do not have a 2023 budget, we cannot amend that budget because it doesn't exist.
Mr. Chairman.
Mr. Shepro.
I believe that in the case of grants and revenues, that they carry over
Special
to the
funds.
revenue side essentially automatically, and then they will be put into the 23 budget at that point. And if they have not been expended, then the 23 budget process would include those.
Hi, this is Canel again. Because these grants are cost reimbursable, it totally makes sense in terms of, although we don't roll it over, we will include it in the 2023 budget for when that process starts. So we spend and then we submit reimbursement requests to receive the funds. And so based on government accounting standards, we will recognize that revenue after it has been earned and within the time frame that is allowable at the end of a fiscal year.
Thank you. I understand.
Call the question.
No further questions or comments. Clerk, please call the roll.
Lewis,
Lewis, yes.
Shepro,
Shepro, yes.
Strathman,
Yes.
Tepe,
Tepe, yes.
Wallace,
Yes.
Silva,
Silva, yes.
Sanchez.
Yes.
Passes.
We have resolution ratifying county board's authorization of wage increases for fiscal year 2022 for department heads under jurisdiction of Public Health Committee. I'd ask for a motion and a second to discuss and potentially pass this resolution.
Lewis motion.
Silva,
I believe Lewis motioned and Silva seconded.
Yes.
yes.
Are there any questions on this resolution? I know Michelle Neerman was here. I don't know if Kathy, you're able to speak to this. I believe this has to do with labor contracts.
No, it's no labor contract.
Shepro, I just was puzzled as to if the county board has already authorized it, why does it have to come back to this committee?
Yeah, that's a state's attorney question. I believe it's a formal ratification of something that has already gone through.
we just received an email from Joe Onsick and he said this is how it had to be done. So it was formality.
Tepe here. I think every committee has to deal with this individually.
It's been on other committee agendas. Just
kind
occurring
of a
to me
housekeeping.
that it seems kind of put the cart after the horse or before the horse or the barn door before the.
Whatever.
Mix your metaphors.
Assistant State's Attorney Don Truce, if you do want me to get that information, I can do that and have an email sent out.
Yeah, I mean, it shouldn't hold up this.
No,
but,
don't hold it up.
It's more of a housekeeping measure is how
Yeah.
I understand it, but yes, that would be.
That's
that would
my
be fair.
understanding, but
Yeah,
Okay, thank you. Yes, a follow-up would be nice. It's explanatory.
as you
Okay.
know, the most frequently given answer in government to anything about why you're doing something is that we've always done it that way.
It's tradition. All right, clerk, please call the roll.
Lewis,
Lewis, yes.
Shepro,
Shepro, yes.
Strathman,
Strathman, yes.
Tepi,
Tepe, yes.
Wallace,
Yes.
Silva,
Silva, yes.
Sanchez.
Yes. All right, we have animal control. Brett is on the line. We also have a resolution related to animal control. So Brett, take it away.
Hello, everyone. Sorry to mute. Good afternoon, I guess I should say at this point. Real quick this month, our numbers ended up for the year in the positive, which is what our goal is every single year, and that's what we're always trying to do. To save some time, I'll skip right to some numbers that will lead into the resolution. If we look at fiscal year 2021 data, which just concluded, we entered 83,283 tags this last year. Some of those had to do from the 2019 to 2020 COVID-related issues where staff wasn't inside the building. We had to decrease our staffing to one person because it's very difficult in here to keep 6 feet to anybody that's ever been in our facility. 6 feet is not a luxury we have. So to minimize, we had to decrease staffing, which caused us to become behind on our numbers. One of the things we did this year was a new computer system, which is automating a lot of our tags. It's going to do about 80 to 85% of them. Getting that system online actually got us almost fully caught up all the way through 2021. We're very excited for that process to get online and get moving with that. That also gave us some better numbers, which will lead into our resolution here in a minute. And the other thing I want to point out is that we had 900 bites reported to us this last year, which is up 48 bites from the year before. Every year they seem to be going up, and that's with the loss of one warden. We've had the position of the warden open for about 15 months now. If you actually go onto the county website, you're going to notice it is one of the longest, it is actually the longest application that has been online under employment since 15 months ago. So part of this resolution we're leading into is hopefully going to rectify some of those issues, as even this past weekend, we lost another employee in my kennels. So we're already to skeleton staff, so to lose more people has just put us even further behind. But the staff is continuing to barreling through. What we're trying to do is get us more in line with what other animal controls are trying to do. Sorry.
Okay.
Chairman, I'll move the resolution.
Mr. Shepro moves.
Second.
FY22 budget adjustment for Kane County Animal Control starting salary change. Wallace seconded. Any questions or comments on this resolution?
If I may, real quick, and I apologize for jumping in. This is fully funded with the increased tag fees that are coming through on January 1st. So this will be totally funded next year. This won't be an issue at all. And the budget adjustments were just to come more in line to make sure everything balanced out correctly.
Excellent. Thank you, Mr. Youngstead. All right, clerk, please call the roll.
Lewis,
Lewis, yes.
Shepro,
Shepro, yes.
Strathman, Tepi,
Yes.
Wallace,
Yes.
Silva,
Silva, yes.
Sanchez.
Yes. All right, resolution passes. We have nothing for old business.
Mr.
Someone,
Chairman, unanimous consent to place reports on file.
any objections? Unanimous consent to replace reports on file. Okay. No need for executive session. Or do we? We do for closed minutes? Okay. So I will ask for a motion and a second to go into
Move
closed
that
session.
we go into
to
closed session
discuss
for the purpose
minutes.
of
Releasing.
determining the annual review of closed session minutes.
Tepe seconds.
Tepe seconds. Clerk, please call the roll.
Lewis,
Lewis, yes.
Shepro,
Shepro, yes.
Strathman,
Yes.
Tepi, Wallace,
Yes.
Silva,
Silva, yes.
Sanchez.
Yes. Thank you to all the staff that came today. Have a Merry Christmas, and we'll be seeing you soon. All right, we have now returned to open session. Clerk, please call roll for attendance.
Silva. Silva,
Silva's here.
Lewis,
Lewis, present.
Shepro,
Shepro, present.
Strathman,
Present.
Tepi,
Tepe here.
Here.
Sanchez.
Here. Okay,
Mr. Chairman.
Mr. Shepro, take it away.
I would move at this time that we release the closed session minutes of September 18, 2019, and that we determine that a need for confidentiality exists as to the remainder of the state's attorney exhibit A as corrected.
Have a second to that motion by Mr.
Strathman,
Shepro.
second.
Strathman seconds. Clerk, please call the roll.
Lewis.
Lewis, yes.
Shepro.
Shepro, yes.
Strathman.
Yes.
Tepe.
Tepe, yes.
Wallace.
Yes.
Silva.
Silva, yes.
Sanchez.
Yes. Nothing for new business. We already had public comments for non-agenda items. Nothing under county board resolutions and ordinances. I'd ask for a motion and a second to adjourn.
As the nearest person to Mr. Kenyon, I will move to adjourn.
Moves.
Shepro.
And second.
Strathman seconds. All those in favor say aye.
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 All those opposed? We are adjourned. Thank you everyone for being here.